Good morning to everybody for the people that it's connected from America, and good afternoon for the people that it's connected from Europe. It's my pleasure to be with all of you today. This is a webinar focusing on an international project coordinated with the Garrahan Hospital in Buenos Aires, Argentina, and with Sant Joan de Déu Children's Hospital in Barcelona, in Spain. This is the international patient registry on people with rare diseases that have suffered the COVID-19 disease. Let me explain a few participation rules. The first one is that please everybody mute your microphone. Also, we recommend to switch off the camera for the quality of the video. Use the chat box for your questions. We have a lot of time at the end of the webinar to discuss with you any questions or comments. And the last point that you need to know is that this session is going to be recorded, and we will upload the video on YouTube for everybody access. Let me introduce the speakers that we have this afternoon in this webinar. We have Dr. Marcelo Andrade. He is a pediatrician working in Sant Joan de Déu Children's Hospital. We have also from the Garrahan Hospital, Dr. Guillermo Chantada. And also it's my pleasure to have in this webinar two patients organizations, Florencia Braga from ALAPA and Roberta Anido from FADEPOP. And myself, my name is Begoña Nafria, and I'm working in Sant Joan de Déu Children's Hospital in the Patient Engagement in Research Department. We are going to introduce a little bit the platform where the patient registry is hosted. This patient registry it's addressed to patients and caregivers, but also it's addressed to clinicians. The registry for patients is hosted in Share4Rare, and we want to introduce all of you, which is this project. This is a European project. Our ambition and our goal is to build the largest digital community for people with rare conditions. We know in the case of the most ultra rare diseases that it's so hard, so difficult to find a peer, another patient or another family suffering the same condition in the same city or even in the same country. And we think that using a digital platform, we can break these boundaries and promote the collaboration of patients and families and the peer support. And this is our main aim in the Share4Rare platform. The project that is granted by the European Commission has three main objectives. The first one is to educate the patients and the whole community about the rare conditions. We have in the public environment of the platform medical chapters. We have also a blog in which we publish information about these conditions. We have toolkits for the patients and for the caregivers. And also, as we are doing this afternoon, we have a lot of scientific citizen science activities such as this webinar. The second objective is to promote the peer support and the care between people of the same community. In this sense, I'm going to explain that we have a private area in the community to facilitate the interchange of information, questions, and experience between the patients. And the third objective, that it's the heart and the core of the platform, it's research. We think that there are a lot of information, a lot of scientific data that can come from the families to the scientific centers. We can analyze this data and we can increase the knowledge that we have about these diseases, because the statistics said that probably around only of 10% of the rare conditions have a very solid knowledge related to their natural history. And in this sense, we put in value all the information that you can bring to us. This is an example of the public environment of Share4Rare. This is a toolkit for the patient advocacy, because we think that it's a key point of our project, the education of the patients and the families. And you know that the rare disease community has advanced a lot and so fast, basically for the advocacy work that patient organizations and patients are doing around the world. In this sense, in this toolkit, you can find plenty of information, but also plenty of tools, templates, and resources to manage your own advocacy project linked to your condition or your organization. This is a slide that summarizes the medical chapters that we have in Share4Rare. We have medical books related to the different conditions that have a research initiative in the platform. You can see here in the screen that we have content about the congenital muscular dystrophies, about pediatric rare tumors, retinoblastoma, and many other diseases. But also we have cross-cutting books for the community, such as the example that I have mentioned about the advocacy toolkit, but also we have another one focused in the palliative care of children with rare conditions, because we think that also it's something in which we need to prepare and educate the families. How does it work, the private area of Share4Rare? For us, it's important to ensure that any person that will access to this private area needs to be a patient or needs to be a caregiver. Caregiver can contribute on behalf of pediatric patients, but also on behalf of adult patients. To become a user of this private community, it's mandatory the registration. It means that you need to fulfill a registration form. We are going to ask several data, not only the personal one to contact you, also your symptoms and your disease, because this is something that it's key for the platform, because we have working artificial intelligence algorithms to manage the community, but also to manage the research initiatives in Share4Rare. The informed consent is mandatory. In the next days, this will be a digital process. Nowadays, you need to print and scan the document. This informed consent is mandatory because, you know, this project is coordinated by an academic institution, and our aim is to promote research. And in any research initiative, it's mandatory to inform the patients about the initiative and to have the signature of the patients. Also, if you agree, you can send to us any kind of medical report to ensure that any data that you can complete in the registration process is right, related to your symptoms and your diagnosis. You will receive an email with your user validation, and after this process, you have full access to all the services of Share4Rare. The People Like Me algorithm, it's the tool that facilitates the peer support, because you can find in the platform all the people that it's there with the same symptoms, the same disease, and that it's living in your country or close to your country. This is a design of this community that we have discussed a lot of time with patients, organizations, and patients, in order to bring something innovative and new that it's not going covered at the present moment for the social media, such as Facebook or Twitter or any other network. For us, it's important to bring tools that can be useful for the families. And as I said, it's a key point for any person suffering a rare disease to find a peer. And a peer, it's not only sometimes a person with your same diagnosis. Sometimes you need a person that can be living with the same symptoms, because there are rare diseases that can be very, very heterogeneous from the point of view of the symptomatology. This is this network that you can see in the screen. It's accessible in your dashboard, and you can connect with every body that it's close to you. Also, we are facilitating at this moment the connection with patients' organizations, because we know that probably not everybody is member of a PO. And we consider that the support that at national level or even an international level they are bringing, it's important for the patients and for the families. In these People Like Me, as I said, you can contact with the patients' organizations, but the most important functionality is that you can put their questions to the people that are in the community and also to the experts. Once you complete the registration process, I have mentioned that you are going to fulfill your symptoms, but also your areas of interest in this platform, and thinking also in which aspects you can help other people. all this data is part of this algorithm and will help to the other people to see which are the questions that probably are interesting for you, or probably you can answer and help the other people. Also, this algorithm, it's helping us to create clusters of undiagnosed patients, because even if you don't have the diagnosis, probably you have symptoms close to other diseases and to other people in the platform. This is a screenshot of the dashboard of the patient's organization's profile. As I said, we have considered that it's very important to put in touch any person in Share4Rare with a PO. If they have a profile, they can complete obviously information that describes the disease and the work that they are doing, but also they can offer support in the community of questions and answers. And they have also the opportunity to have private messages with everybody that have allow to access to this connection with patients' organizations. This is another screenshot where you can find, and this is in the public environment of Share4Rare, the POs that at this moment are part of Share4Rare. It's only a part of the list. We have other patients' organizations in the platform, and we expect to have new ones probably coming from this webinar. And now I'm going to bring the voice to Dr. Marcelo Andrade to introduce the International Patient Registry of COVID-19 in people with rare diseases. Thank you.
Thank you very much, Begonia. Good morning and good afternoon to everybody, according to where you are. My name is Marcelo Andrade Vigo. I am a pediatrician at Sant Joan de Déu Children's Hospital in Barcelona, Spain. First of all, thank you for your participation in this webinar. I would like to commend you just a little statements about rare diseases and about the registry we want to carry out. Rare diseases affect a small number of people compared with other prevalent diseases in the general population. In Europe, a rare disease affects less than 1 in 2,000 people. To date, more than 7,000 rare diseases have been documented, and new ones are reported regularly in the medical literature. There are more rare diseases than prevalent diseases. Rare diseases frequently remain undiagnosed. About 50% of the rare diseases affect children and adolescents. The next one. Thus, patients with rare diseases have double vulnerability to the pandemic. They have the effects of the SARS-CoV-2 and difficulties for medical care during the pandemic. According to this situation, we ask ourselves two questions. How does SARS-CoV-2 affect patients with rare and undiagnosed diseases? And how is the access to the different medical care modalities? There is one. In order to answer these questions, we designed this collaborative international registry. The objective of this study is to know how SARS-CoV-2 affects patients of all ages, children and adults, with rare or undiagnosed diseases. Clinical and psychological records of information will be provided directly for patients or caregivers. Through a series of questionnaires, information will be collected from patients who have had a SARS-CoV-2 infection. We also designed a questionnaire for physicians. Both questionnaires must be completed also at 30 and 60 days. The next, why this collaboratory study, international study? Because rare diseases are a common medical problem in the pediatric general practice. They affect around 6 to 8% of the world population. Patients with rare diseases may have increased risk in case of SARS-CoV-2 infection, because confinement and lack of medical care during the pandemic may impact negatively in their evolution. And because due to the low prevalence of a specific rare disease locally, we believe that joining efforts through collaborative international studies will allow us to learn more about them. In conclusion, at this moment we know that children with SARS-CoV-2 disease have been less affected than adults in terms of severity and frequency. Age and pre-existing comorbid conditions were a strong risk factor for severe illness. Until last week's, from our records, I mean Garrahan and Sant Children's Hospital records, we analyzed 631 patients younger than 18 years old. 12 patients, it means 1.9% suffer a rare disease. We didn't include patients with childhood cancer. 3 patients, 25%, require ICU. 1 patient with cystic fibrosis died with COVID-19, no by COVID-19. 2 patients with organic acidemia and metabolic decompensation improved after being in ICU. Anyway, Begonia, this is all for me at this moment.
Thank you, Marcelo. Let me introduce a little bit which is the process, because I have mentioned to all of you that you need to complete a registration form. You can see in your screen, which is the dedicated landing page and the registration form for the COVID-19 patient registry. As I said, in this process, it's required personal data, but also data about your condition. It's very important that you complete all this information to facilitate this accurate process to connect with patients in the community. Even if you are not a patient with a rare disease suffering the COVID-19, we want to invite all of you also to take part of the Share4Rare platform, because the platform it's not only focused in this case of the COVID-19 patients. It's open to everybody, and also we have other research initiatives at this moment working. We have a project focused in acute lymphoblastic leukemia, another about pediatric rare tumors, a third one about neuromuscular diseases, and another one about the undiagnosed community of patients that I have mentioned previously. Share4Rare, it's a platform open to everybody, but considering the effects and the impact of the pandemic of COVID-19 in the whole world, and obviously in the people with rare diseases, we agreed to set up this registry with the aim, obviously, to know better which is the impact of this condition in the patients with rare diseases, and hopefully to improve in the future the care that we can bring from the hospitals. Also, as Dr. Marcelo mentioned, we have a patient registry dedicated to clinicians to report cases. This is not hosted in this platform. If there is anyone interested to contribute, please contact us. We are going to put in the chat box our email of contact. It's another platform where you need to access and report any patient that you have take care with this condition. The process is the same. You will find the initial questionnaire. At the 13 days, you have to complete a second one, and at the 60 days, you have to complete the third one. It's a collaborative project. We are very glad to be part of this project and to coordinate the initiative with the Garrahan Hospital in Argentina, but also this project never moved forward without the support of the patients' organization. I want to thank FADEPOV and ALAPA to be part of the team of Share4Rare. And before to open the questions and answers, I want to invite Roberta and Florencia to explain the importance about this registry from the perspective of the patients. Roberta, if you can, I don't know, open your micro, the floor is yours.
The microphone.
Or Florencia. I cannot see the people, or if they are muted or not.
No,
probably they follow the rules.
Okay.
You hear me now?
Yeah.
Well,
yes.
Good morning, good afternoon to everyone, and thank you very much for joining us. This registry is of a great importance for the rare disease community, because it allows us to know in the first place where these patients are from, what disease they have, how was the evolution they have with COVID-19, the treatment they receive, the consequences that appears or remains, and thus allowed us to be able to continue working on public policies to improve the quality of life of our community. So we try and to say to us, everybody, that's why we need that patients, relatives, caregivers, and doctors register their cases in this international registry. Thank you very much.
Thank you, Roberta. Thank you very much.
Florencia, if you can introduce yourself and explain a little bit from your patient organization, your commitment with the project.
Hi, how are you?
Hi, Florencia.
Trying to put my mic on. Well, I'm super happy because I think that this is a very important moment. We are trying to start a moment of important share in order to understand the problematic, because the word of the rare diseases is not a local word. We really need to understand that the way in which we will work in future years will be global, have to be global. If you speak about precision medicine, you need to understand that there is a word of post-genomic understoods that we have to put on the table. And I think that we have to improve our actions, trying to put in the table together the word of the governments and the diseases. I think that Share4Rare is a very important initiative. I think that Begonia has made, wow, she was the first in Europe that was interested in our problematic. I remember when we started with the disease of my son, with Stargardt, that she was interested about what was happening with us and our relations with the people of Europe in the same line of work. You have to be strong. And if you want to make advocacy, if you want to advocate for patients, you have to be strong and disobedient. The unique word that have to be your authority is this one, is the space that we share as organizations. This global situation of patients is our own authority, and everything else has to become a partner in the work, but not an authority. And this is very important, and I think that this is the way that we are sharing and we are changing now our word. Welcome everybody, and I think that for our organizations it's super important that everybody understand that we are a part, we have to speak, we have to be proud and to work for this pride. So thank you very, very much, so much to this organization. Thank you to doctors, and thank you, Share4Rare.
Thank you,
Florencia. Thank you. I cannot see the names online, but I think that also we have the pleasure to have with us this afternoon Dr. Guillermo Chantada, that I introduced at the very beginning, and I want also to bring a short time to introduce the role of the Garrahan Hospital in this project and to address to all of you a few words. Is your time, Dr. Chantada.
Yes, thank you very much, Begonia, dear friends. It's a pleasure for me also, because I have the privilege of working at both sides of the Atlantic. I spent time in South America working at Garrahan's hospital, and also spent time at San Juan de Déu, and so in Barcelona. So that I have the chance of, I always say, like building bridges. And this bridge, I think it is really, really important. We have also at San Juan de Déu many collaborations with other Latin American countries and other countries all over the world. So I think as Florencia said, these initiatives have to be global, or they shouldn't exist, because they really is the only way I can mention our experience in a similar registry we did for childhood cancer and COVID, which we have already more than 900 children registered. And from all over the world, more than 35 countries collaborated in that registry. And that registry made us learn, for example, that there is a population that we didn't know that were at higher risk of mortality or at having a severe COVID infection. So now we know that, and the only way of knowing that was through a registry, because each country had 20, 25, 30 cases, 40, maybe 60 cases, but these complications are rare, so you never know with so limited number of patients. And that is even more critical in the rare diseases arena. So this project is not only excellent scientifically, but it is a necessity from the public health perspective to take the necessary actions. This virus is here to stay. It didn't go away. When we started the project, we thought maybe it lasts 3 months and then we won't have the virus anymore. But it seems that the virus is here to stay and we should be prepared. So thank you again for leading this project, Begonia. It's a really an absolute great initiative. Thank you very much.
Thank you,
Thank you
Guillermo.
Thank you to everybody, because this is a collaborative project, and from Sant Joan de Déu Children's Hospital on all the team that it's behind. And also, we have the pleasure to have as a principal investigator, Dr. Marcelo Andrade. It's a pleasure to work with the Garrahan Hospital. Thank you very much. Is the time for questions and answers. As you know, you need to add your comments in the chat box. I can read that we have people from many patients organizations and many countries. We have people from Alianza Lisosomal Argentina. We have people from Valencia in Spain, from the Grupo Síndrome de Alport, de Alapa, Porto Alegre, Brazil. Boa tarde. From many countries. It's a long list of comments. Thank you to be with us, and we will expect to have a very nice discussion now, because the clinicians are here to help you and to reply your questions. Please add your comments in the chat box, and I'll try to facilitate the discussion.
Begonia, I have read a couple of the chats.
Okay.
I can help you if you want.
Yes, go ahead.
There is a question from Maria del Carmen Feican from Ecuador. She says that she has a child with a glucogenosis type 6. And I think it is not exactly related to COVID, the question, but I think Maria del Carmen would need some guidance about the condition that his child would have. Could we, maybe we could type some addresses for her or to support her, or to have the chance of having a consultation at Sant Joan de Déu or at the platform, maybe?
Yeah.
Okay, thank you.
I read here the question. Oh, Florencia.
And there is also...
The microphone, Florencia.
Okay, yes. I was thinking that something that we have all together in common now is the problems that we have with the fear that people have to be discriminated in terms of attention during the COVID pandemic. You know that if the supplies in the hospitals are not enough, everybody is wondering, I will receive attention if I have a person with this situation of health that maybe is difficult to put in order to be understanding by the sanitary word. I don't know if I'm being clear, but I think that the governments don't give answers to the fear of people with rare diseases in terms of being listened during the pandemic. And this is a problem that we want to work together from the table of bioethics that we have. We wonder that all the news that you read in the newspapers about people who was put out of all the hospitals because they were very bad to receive attention. Well, this is a problem that we have. We have people that have horrible conditions, and maybe they are being afraid of being discriminated. I think that we have to make an agenda of all this richness that we have been together in this table today. I don't know, Begonia, if we can make something else, but this is a presentation of the registry. But I think that when I read all the chat, it's plenty of people that need to share more. And this more has to do with our needs, with our social needs, our political needs. I think that this could be a good start. I don't know what you think, but I mean that we have to improve our relation between the countries. So the American countries have no relations that are formal, but really in terms of help, we don't have it. So we have tools like, for example, the Mercosur, that we are not improving in terms of help for health. The organizations, the Pan American Organization for the Health, the OPS, Organización Panamericana de la Salud, has to participate. I think that we can prepare a doc, a file about all these things that are moving between the Share4Rare initiative, and we have to make the Organización Panamericana de la Salud to participate in answers, because there is plenty of people that feels that are not considered. Thank you.
I think, Florencia, you are right. I think it's very important due to the prevalence that you should work all the work together about research in rare diseases. Now, I'm reading two questions now, one from Raquel and the other one from Gregorio, about the impact of COVID-19 in patients with early run loss and muscular dystrophy. I want to tell you, to everybody, that we don't know, and because of that, we want to do registry at these studies, you know, because this is a new situation, and we, the physician, should learn about this new situation. Because of that, we are carrying out this registry. And please, because of that, we think that it's very important you help us into registry your patients or your relatives with these conditions.
Thank you, Marcelo. I want to highlight also something that Florencia
Let's see
said.
other questions.
Can you hear me?
Yes.
Okay, sorry. No, I want to highlight something that Florencia said. I think that collaboration is the key point to move forward. And obviously, every nation has their own policies and their own resources. But at the end, there is something that it's common, that it's the access to the healthcare and also the opportunity to be part of a research initiative. And the only way to move forward when we are talking about rare diseases and basically also in the ultra rare conditions, it's to work together. And in this sense, for the reason I have mentioned, that Share4Rare, it's not only for the people that they have suffered the COVID-19 and they are patients of rare diseases, it's for everybody with a rare conditions. And our aim there is that you can access to this community, you can put there your questions, your concerns. If the question requires an answer from the medical team, we have behind all the team of doctors of Sant Joan de Déu, and also we are working very close with the Newcastle University in UK to help the patients. Obviously, Share4Rare it's not focused in a telemedicine service. We cannot provide healthcare service, but we can provide information. And if you need any kind of access to a medical service, we can try to see if we can support you in this sense, because we have an international department in our institution. And in this sense, I think that the platform is for all of you. Try to access to become a user, and any need that you can have, please contact us.
I read another question about how impact COVID-19 in patients with cancer. Guillermo, I don't know if you want to, you read the questions, this question.
Yes, of course. I know the situation in pediatric cancer. I don't know if the question is about adult cancer as well, but in pediatric cancer, we found that the mortality is lower than we could expect, but there is a population, it is higher than in the general population. So children with cancer, very few of them would die, maybe about 3%, and so it is not very high, but it is higher than that presented by children that don't have cancer, children with no other condition. And in the subpopulation of children with cancer, those with leukemia or lymphoma, or were the ones that had bone marrow transplantation, have a much higher risk. So we should be taking more action to prevent this disease in these higher risk children.
Good. Any other question?
I have read also a comment from Natalia, if I'm right. Yeah, I can read in Spanish. She said, desde Argentina estamos iniciando una investigación sobre el impacto de COVID-19 en la calidad de vida de las familias con una enfermedad poco frecuente. Y comenta, ¿no?, que estarían encantados de colaborar con el proyecto. Thank you, Natalia, for this question. Yes, we have discussed with Dr. Marcelo Andrade and with other colleagues that beyond to collect the specific medical information about the patients with the COVID-19, at the end, everybody has been affected by the pandemic, and moreover, the vulnerable group of people with rare conditions. And in this sense, please contact us, because we will be very glad if we can support with this study, because at the end, Share4Rare is a tool for patients' organizations and for the research community to move forward with new initiatives. And we will be very glad to know which is the impact of the COVID-19, not only in Argentina or in Spain, with all the other countries that are represented this afternoon and this morning in this webinar. Thank you, Natalia. Okay, there is also a question from Anna. She wants to know about the data of children and teenagers and adolescents. I suppose that, Anna, you are referring of the data that we have in the registry. This is something that Dr. Marcelo Andrade introduced a little bit, because the patient registry is quite new and we have few cases at this moment registered. Let me know if you want to know any other thing about the data related to children and teenagers, because this is the area of expertise of our hospital. Okay, related with patients with sclerodermia.
We need this collaborative study in order to have many patients with many diseases, with every disease. Because of that, we are calling you to help us and to know more about how COVID-19 impacts patients with every rare disease. I know nobody knows yet. Nobody knows how this virus is affecting patients,
Right. Roberta, you want to add something at this point?
Yes.
Or related to the question that already it's before your comment? Yeah, okay. Marcelo, there is a question from America that
no,
yeah,
if the diseases don't you know, we don't know yet. We don't know how regular patients respond to the disease. Because of that, we think this is very important. And because patients with rare diseases are so low, have so low prevalence, this is very important to work together in order to obtain a bigger information about the effects of this virus in this kind of patients. We have the same doubts. We have the same doubts that people have, you know. We could think as a physician, according to our previous thoughts, how this virus affects these patients, but really, we don't know yet. Nobody knows. Nobody knows because we are learning in these last months about it, you know. I think in order to be sure, we have to carry out this study and to make conclusions.
Thank you, Marcelo. I know that Roberta wants to add something. Please, can you, the technician can open the microphone of Roberta? Let's wait a little bit because you know that we have this translation and we are a little slow adjusting technical things and we need to have unmute the microphones. I suppose that Roberta, it's something long that you want to share and it's easy to use the micro instead of the chat box.
It's okay, I'm now here.
Go ahead.
No, it's relative what Florencia and also Marcelo said, that if we need to do something globally, that I absolutely agree. We need to involve and to ask national organizations from different diseases to be more engaged and to be more commitment about this project, because we need to have more information in order to try to start working on different projects as a global level. So we need every state and every organization must be more commitment and also express this registry and try to ask people and physicians to register. So that's the way I think that we have to move forward.
Thank you, Roberta. In this sense, I want not to encourage everybody that can be part of a patient organization to spread the word about this patient registry, because patients, they need to know that we are gathering this information and we want them helping, completing these questionnaires, but the same from the clinician community. We need that you donate this information from the clinicians community. Probably, Marcelo, you can explain a little bit, because I know that this afternoon we have researchers and clinicians, but also there is a collaborative project for them to be involved with us.
Yes, we thought that this information could provide from patients and caregivers and from physicians as well. We have two kinds of questionnaires. One who are answered for physicians, another one who are answered for patients and families. According to that, we think that's very important that clinicians and physicians answer these questionnaires, because they will help us in order to get this information. Also, I think that it's very important for them. We want to help them, and we are thinking that they should be part of our study as well. We invite them to be part of our study. Also, they could access to our information, and they could be part of this community of patients with rare diseases. I think that this is a collaborative study, and for us it's very important that this information could be obtained for us, for everybody. Okay.
Mm-hmm. Thank you, Marcelo. It's important also that you know that we are working with this open data model in the platform, and if there is any researcher or doctor interested to bring to this database that at the end it's behind of the answers of these questionnaires, any new question, we are going to be glad to help on this. And also there is a question in the chat box from Natasha related to the patient registry. She's asking about which is the biggest international database and who manages it. I don't know the answer, because it's plenty of, at least in the European context, that it's environment that we know, it's plenty of different patient registry. And the European Commission it's working towards to try to connect this patient registry and obviously to join efforts. But you can find at the European level in the same country for the same condition more than one patient registry. And this is the complex part now, trying to interconnect these databases. It's challenging, but I know that there are public policies moving in this direction, at least at the European level. Also, we have another question here from Carmen. Probably, Marcelo, you can read. It's about an autoimmune condition.
Where is it?
Carmen, I can read if you want.
Carmen.
Yeah.
Good afternoon. I want to send a relation for the same answer, we don't know. Because of that, we are trying to learn about this registry. We don't know yet. We don't know. Mm-hmm. We could say according to our previous thoughts, but we don't know it, really.
Mm-hmm. Okay, thank you. Also, thank you to Veronica from the MPS organization from Argentina, because she's mentioning that 2 patients from this PO have already registered in the patient's registry. Thank you, Veronica. Flor, you want to say something?
Yes, I was interested in think together, and to think together what we can do for improving the best of the situation that we have today. No, I think that maybe everybody can send a mail to the mail that Begonia put in the screen, and to create an agenda, because we are 88 people here today. There is so much that that we can prepare a work table, a group of work. Everybody has questions. Everybody is needing answers, but it's not serious to answer so early. We need to prepare this knowledge. So I want to invite everybody to create a little group of 88 people to work together, because the webinar is being recorded now. So maybe we can record also the data of the people that is in the chat, if everybody allows it, and to create a platform of I am listening to the translation, so it's very it's crazy what I am doing, but I'm sorry. Yes, I have to. Yes, I have to. Yes, I want.
Case, I want to be sure, Marcelo, if we have the answer for this, because this attendee of the webinar is asking about if there is any study related to the origin of the. It's difficult for me to translate into English. Sobre el estudio.
Sí. En Spanish. ¿Estudio?
Sí, quiere saber si hay algún estudio sobre el origen de cuadros con múltiples patologías autoinmunes.
Hay mucho.
I think this study is related to the effects of COVID-19 in patients with rare disease. Many people are asking about how this virus affects their one specific illness. And again, we don't know. I think that this initiative is a good opportunity to make relationships between families who share the same diagnosis and the same illness. Because of that, we think that if a family make relationships with another family who have a member who suffered a specific disease, this will help us to study more about this specific illness. Because of that, because of the prevalence, we think that this is a good opportunity because we could connect people from all around the world. And this is a good opportunity to start. I think could be a good starting point about research in patients with rare diseases. Because of that, we don't know these specific questions. I don't know the specific questions yet, but we could help people to make relationships, and we could make facilitate research, and we could stimulate colleagues to make research, and we could help colleagues to be part of our research.
Thank you, Marcelo. Thank you also to Diana, because she has informed in the chat box that his daughter with the Rett syndrome has suffered the COVID-19 without any symptom, only a few mild symptoms related to the color of the nails, a few degrees of fever, and she's going to be glad to report the info in the patient registry. Thank you, Diana. We are going to share now in the chat box the link of the landing page, and everybody that can be connected also can access directly to the registration process of this study that already we have explained how it works. Thank you. Okay.
You know, Begoña, I want to tell that we had a patient with Rett syndrome and COVID-19, and the evolution was really fine. He didn't have a big problem with this infection.
This is good.
Yeah. Then we know two already, you know?
Yeah. Carlina also it's mentioning in the chat that can be interesting to add to the registry the people that they don't have the diagnosis. It's open to them also. Sorry, because probably we forgot to mention, but if you have the suspicion of a rare disease and you are looking for the confirmed diagnosis, also if you have suffered the COVID-19, you can report the info in the patient registry. Thank you. Okay.
There is someone that is reporting his son with San Filippo and COVID in the chat.
Yeah. Yeah. Sorry, because it's too long.
This is
the text
starting to move.
Yeah, this is great. Thank you, Diego, to inform about this, and we are going to be happy to help you to report the info in the patient registry. Okay. I don't know if there are more comments or questions. Sorry, because we cannot allow to all of you to open your microphone for the automatic translation that we have. But I think that basically we have covered all the comments. We are going to also have a copy of your comments in the text, in the chat box, and we can reply afterwards if we miss anything. I don't know if the doctors, you can highlight or say a few words before to close the webinar. Marcelo, Guillermo.
Oh, just to stress once again what you said wisely, that This is the only way. The collaboration is the only way to generate evidence, and generating evidence will save lives. So this is not because we want to do a paper, and this is not because we want to present the results in the Congress. This initiative may save lives, and these lives can only be saved by information that could be generated by this kind of work. There's no other way in the health system to generate this evidence. So please contribute to this initiative, share it with your colleagues, invite people to join, and let's keep on saving lives.
Thank you, Guillermo. Marcelo.
Just telling the thank you to everybody. And like Guillermo, I think the same way. I think that we want to help patients with rare diseases. We want to be part of this big community. I want and we want to help families and patients. And please, we have to take conscious about to make a big group, and in order to improve our knowledge about these situations.
Thank you, Marcelo. Roberta. Please, if the technician can open the micro of Roberta. We want to hear the closing words from her. While probably the technician is adjusting this, probably Florencia, you can say a few last words.
I'm super happy and grateful, and I want to say that I believe in this kind of initiatives. It's very moving. I'm sorry about Pandy. Pandy is my dog. He's a very good friend of the rare diseases. He's always working together. And really what I want to say is that it's moving to see all the energy and the desire and the need that you feel when you open the chat. So let's work together, everybody. This is the only way. Thank you so much, Begonia, for this initiative. And I want to make everybody to realize the possibilities that we have if we start something closer. I think that this is a very good experience to start the registry and to start the communication. Two things. The registry is super important, and we can see it in the chat, and also direct communication that all this technology that we are using now with the COVID allows us to experiment, and it's fantastic to feel closer, Thank you so much to everybody.
Thank you, Roberta. Let's see if we can switch on the microphone of Roberta.
Of floor to Roberta.
Crossing fingers, technology. We want to hear Roberta. Let's see. I have requested also by the chat to the technician, yes, but probably it's managing in parallel many. Okay, right.
Well, I absolutely agree with Guillermo's words, and I want to thank Share4Rare and Sant and Garrahan Hospital to allow us as a patient representative, the voice of the patient in this working group. And it was really a pleasure, and I think that working together we are stronger. So that is my final words, so thank you very much.
Thank you, Roberta. And finally, to close this webinar, I think that we need to thank you, Anna. She's helping us today with the automatic translation. I know that it's not
great, fantastic translation.
Yes, okay. I'm in the English side, and she said that I speak very fast and I try to speak slower, but I know that it's not easy. Thank you, Anna. And also thank you to everybody that have been attended to this webinar. You will hear soon from us. We are going to upload this session to YouTube. My team is going to contact you to send the link of the video. Someone also requested the slides. If you want the slides, there is any problem to send also to you. And we are working also with our colleagues from Garrahan Hospital to organize a digital congress in November. The congress is going to be addressed to patients, organizations, and clinicians and researchers. And also you will receive soon the agenda of this event that it's focused in general in the COVID-19 issue and pandemic affecting people with rare conditions. And also we are going to have activities to have sharing moments. And I think that also learning moments between the different models that around the globe are working to care the patients with rare conditions. I think that it's the moment, as Florencia, Roberta, and all the colleagues said, to collaborate, but also to learn from one to each other. And this is not the end, as the song, it's the beginning, we hope, of a collaborative and a strong project for your community. We are here to help to all of you. Thank you so much.
Bye-bye to everybody. Thank you.
Thank
Bye.
you. Bye-bye.